Hello, Dr. Gelota. My name's Valerie Hernandez, and today I'm doing my presentation on HIV and AIDS. So, what is HIV? So, HIV is a virus that weakens an individual's immune system. So, this virus is known as human immunodeficiency virus. And what this virus does is that it infects um, the healthy CD4 cells of that person's immune system. So what it does is just it weakens the person's immune system, which prevents that person from like fighting infections or any diseases. So that's what HIV does. And so AIDS is related to HIV. So if AIDS can progress to oops, I'm sorry. HIV can progress to AIDS, and AIDS is a set of symptoms that are brought on by the HIV virus, and AIDS stands for Acquired Immunodeficiency Syndrome. And unfortunately, if AIDS is left untreated, it can cause death. Okay? How is HIV diagnosed? So, primarily, HIV is diagnosed by blood tests. That's really the only, technically, it's the main way for a person to find out if they're HIV positive or HIV negative. So primarily it's done through a blood test, but there's other tests that a person can do that can, tell them if they're HIV positive or HIV negative. And one of these tests is called the ELISA test, and then the other one's called the Home Access Express test, which is a test you can take at home, and a saliva test, which I believe it's a cotton swab, or if not, it's a viral saliva, and then a viral load test. Technically, the viral load test is used after the person is diagnosed with HIV, but I'll explain about that test a little more into the presentation. Okay, so then next we have signs and symptoms. So there there are some common symptoms of HIV, and they are if a person has diarrhea that lasts for more than a week, or if they have a dry cough, or if they're experiencing memory loss, depression, and neurological disorders, or if they have pneumonia, or if they are experiencing extreme unexplained fatigue with no source as to what can explain why they're feeling so tired. They also have rapid and sudden weight loss. Not only that, but they can experience recurring fever, so fevers that keep on coming back, or profuse night sweats. And they can also have red, brown, pink or purplish blotches on their skin. As you can see right here in this picture, I'm covering them. I apologize, but they can have it on their skin, or under the skin, or inside the mouth, or in the throat. And another sign that a person may have HIV is if they have the swollen lymph nodes, which it can be found in the neck and the armpits and in the groin area. So that could also be another telltale sign for a person to get checked to see if they have HIV. Okay, and next we have, okay, so as we know, HIV weakens a person's immune system, and HIV can progress to AIDS. So when it gets to full-blown AIDS, that's when it's more of a problem. It's more of an issue. The person can catch infections so easily. It can be very detrimental to their health. They mainly catch infections that normally wouldn't really, uh, you know, uh, cause a person with a healthy immune system any harm, nor would it lead to death in a normal, functioning, healthy immune system. So these types of infections that can be very severe to a person's health and can cause death in a person that has AIDS are known as opportunistic infections. So these are some of the common infections. Um, they're kind of hard to pronounce, but I will tell you about the first three infections I listed are caused by funguses, and the person can catch this infection is by breathing fungus spores. And then you have encephalopathy, HIV related, and this is related to the brain. So this encephalopathy, HIV related, has no known cause. Its cause is unknown, but medical professionals know it has something to do with the brain, and because of that, it causes inflammation of the brain, which is not very good. And then we have herpes simplex virus. Now, this is a common virus that many people can get, and it doesn't do any harm to them. But for a person with AIDS, this becomes an opportunistic infection because it can, severely damage the bronchus, the lungs, or even the esophagus. It can make it hard for them to swallow, I believe. So this is when an infection like this becomes an opportunistic infection because it can potentially kill the person when it normally shouldn't. And then we have Kaposi's sarcoma, and then tuberculosis and pneumonia, which seems to be a common infection that people with AIDS get, as I've noticed through my research. And then we also have toxoplasmosis, and toxoplasmosis is a parasite, and it's a parasite that's found in warm-blooded animals, such as, your cats, rodents, and birds. And this parasite is found mainly in their feces. So if a person, comes in contact with the feces and the parasites there, they can catch an infection, or even this toxoplasmosis parasite can even be on food. So if it's on their food, then they can catch this infection, and then it causes many problems. And toxoplasmosis, I believe, damages a lot of vital organs, such as, the brain, the heart, the pancreas, the liver. It really messes with a person's body. So it's a really big issue if a person contracts toxoplasmosis. So the causes of HIV and AIDS. So, we know the cause of HIV is because of the human immunodeficiency virus, and that weakens a person's immune system, and it, makes them more prone to getting infections. And so we know that HIV can progress to AIDS, and so HIV is transmitted from person to person in 4 ways. The first way is having unprotected sex, whether it's man with man or man with a woman, that can be transmitted through those ways by just having unprotected sex. And it could also be transmitted through sharing needles used for drug purposes, so drug paraphernalia. It can also be transmitted that way. And another way is blood transfusions. So with blood transfusions, it's pretty rare. It's a rare occurrence for someone to contract this virus. But a long time ago, I believe they didn't screen the blood that was donated to like blood banks or to the hospitals. So some people were able to actually contract the virus through a blood transfusion. But luckily, they do screen every blood that is donated through a blood bank or a hospital. So, for a person to catch HIV through a blood transfusion today, it's pretty rare. It's pretty rare. So, and the last way is during pregnancy. So, if a woman is pregnant, she can if she's pregnant and she has HIV, she can transmit the infection to the fetus, or it can be transmitted through delivery or by breastfeeding the baby. So those are the four ways. And the other ways that HIV cannot be spread by or be contracted by is by kissing someone who has HIV, or hugging someone who has HIV, or shaking hands with someone who has HIV. And it was believed for many years that using the toilet after someone who has the virus was a way to catch the virus, but that is not true. And it also does not spread through the air, water, or insect bites. Okay, so HIV is managed by medications, and this or therapy or treatment is known as the antiretroviral therapy, or simply ART. And with many medications, there comes a lot of side effects, and this is no different. This treatment does have side effects, and these side effects include nausea and vomiting, diarrhea, trouble sleeping, dry mouth, headaches, rash, dizziness, fatigue, and pain. Okay, so the pathophysiology of HIV. So the HIV virus attaches to and penetrates the T cells in the immune system. And it does it via the CD4 plus molecules and chemokine. And so once the attachment is completed, it will release HIV RNA and HIV encoded enzymes into the host or the T cell. And so once that happens, the replication of the virus begins, and then we get reverse transcriptase, and this is when reverse transcriptase is when HIV RNA gets copied to produce viral DNA. And so during that process, errors can occur. And when errors occur, it can cause mutations of the HIV virus. And so when mutations happen, it's not a good thing, because mutations can bypass the control of the host immune system, and it can resist the antiretroviral drugs as well. So with the infected cell now, as it has the proviral DNA, it will divide, and as it divides into new cells with that proviral DNA, it will take a copy of that meshed viral RNA with the DNA of the host cell. It will just keep on replicating that viral DNA. And so that proviral DNA can be transcribed to HIV RNA and then translated to HIV proteins. And then these proteins are made into HIV virons. And so these virons can be produced by the thousands. So these are the ones that are produced are immature virons, but then they will be converted to mature virons, which would then allow for the infection of these virons to begin. Okay, so the epidemiology of HIV. There are three distinct patterns that can affect any country around the world. It does not discriminate. So the first pattern of HIV in which HIV can spread is men who have sex with other men. This is seen in many developed countries, The second pattern is when a person comes into contact with infected blood, and this is seen mainly in Africa, South America, and Southern Asia. The third pattern is HIV infection through heterosexual intercourse, and this is able to spread along migration to cities, routes of transportation, and this is what enables it to spread to rural cities and areas. And in South Africa, it's really bad with the HIV epidemic, AIDS epidemic. It's very bad there. And so this HIV virus has killed millions of young people, and many of these young people had children. So a lot of these children were, they're being left orphaned, which is very, very sad. And there are some factors that influence the rates of infection in South Africa, which is poor education, poor healthcare systems, which means they don't have access to a HIV blood test or antiretroviral treatment, and poverty and domestic violence, so they don't have any awareness of how the virus is transmitted, and they don't have any background of the virus. And so as of 2019, 25.4 million people with HIV were able to access the ART treatment. So that's a good thing. And it's currently increasing. People are the way people are able to access it. It's currently increasing, which is decreasing the rates and the cases of HIV. Okay, so the prognosis of HIV is very poor if it's left untreated. The mortality rate is 90% if it's not treated. The average time frame from time of infection, if it's not treated, is 8 to 10 years. And sometimes it can be less if there's no improvement or there's no good progress if treatment is used. And these are some of the factors that can influence the rate at which the virus can keep on infecting the individual. And then this includes alcohol use, mental health state, your CCR5 delta 32 heterozygosity, infection of another HIV strain, nutrition, age, and if a person has HIV, if a person develops AIDS and is not treated, they have approximately 2 years to live. Okay, so the prognosis of a person using the ART treatment is good. Taking this medication every day will reduce the viral load. So the viral load is a way for a blood test to detect any HIV antibodies in the blood. So if there's so if the person that's taking these medications correctly, the viral load will become virtually undetectable, which is a good thing, which is the goal. And so the total number of diagnoses has declined since 1994. The life expectancy for a person with HIV is up to 70 years of age. There are some factors that can influence or increase the life expectancy for a person, and that is catching the virus right away, taking the appropriate medications, quitting smoking, having safer sex, exercising, addressing and taking care of other health issues along with HIV, and eating healthy. So the history of HIV, it was believed to be transmitted from chimpanzees to humans by hunters that ate their meat or got their infected blood of the chimpanzee in their cuts and wounds that may have happened during the hunting process. And it was believed that the chimpanzees in the area had SIV or simian immunodeficiency virus, and it's closely related to HIV. And so this was all believed to have happened in the Democratic Republic of Congo. A man named Luc Montagnier and his team at the Pasteur Institute in Paris discovered HIV And him and his team actually did end up winning the Nobel Peace Prize for the discovery. And this is him, this is Luke. And this is Robert Gallo in 1984. Him and his team at the National Cancer Institute in Maryland suggested that the virus had an involvement that causes AIDS. So there are some current clinical trials to see if HIV vaccine can be developed, but right now it's not looking like it's possible. The body needs to produce these antibodies in order for it to fight off the disease, which is what the vaccine is aiming for the body to produce these antibodies. Okay, so these are celebrities who have and who have had HIV. So as we know, Eazy-E, he was part of the group NWA, the hip hop group. He unfortunately passed away in 1995 from pneumonia, 1 month after he was diagnosed with AIDS. And then we have Magic Johnson in the middle, and he announced that he was HIV positive in 1991, years after his diagnosis. He was still involved with sports, he was being active, he was not shutting himself from the world. But he also started the Magic Johnson Foundation, which is an organization that aims to prevent the spread of HIV. And last but not least, we have Freddie Mercury, who was the lead singer of the rock band Queen. He kept his diagnosis a secret for many years, up until his death. A few days before his death, he announced his diagnosis to the world, and unfortunately died in November 1991 from pneumonia as a complication of AIDS as well.